When patients come in with signs of runny nose, itchy eyes, congestion, cough, and you do the skin testing, what treatment is there for allergies?
When the patient comes with allergy conditions like you, which is allergic rhinitis, it depends on the severity of symptoms. Also, when are their symptoms the worst? Are the symptoms worse outdoor, or their symptoms are worse indoor? Because there are certain allergens which are more prevalent outdoors, and there are certain allergens which are prevalent indoor. If the patient's symptoms are severe enough that they cannot be controlled with topical medications like topical corticosteroids or oral antihistamine or mast cell stabilizer, then there is another next step which is really curative. It's called allergy immunotherapy or allergy shots. Basically, what we do is we take the results of the allergy testing that we have conducted in the previous time or previous consultation, and we look what exactly is triggering their allergies. And we, based on that, come up with a specialized treatment plan for that patient, a customized therapy, a individualized therapy based on that, and we make a special serum or a vaccine for that particular patient. It can be a one teeny tiny injection in their subcutaneous tissue or in their arm, or it could be more than one, no more than two most of the time. And we slowly escalate the dose of that allergy shot treatment over the period of 6 months to 1 year. It is a little bit of commitment, but it takes almost 6 months to get from a very low dose of very light form of immunotherapy to the very concentrated form. But it's a journey. A lot of patients tolerate it very well, and we have an excellent record of patient recovering from their allergy condition, sometimes even permanently after the 4 year of treatment. It's very effective. It's with minimal side effects, and most of the patients are able to get off of their oral medicines if they ever been on it.
Okay. And how often are they having to come into the clinic for these injections?
Sure. So it depends on the patient's ability to come. We at least request them in the beginning or the for the first year to come at least once a week. But if they're available more than once a week, they can come up to twice a week in any of our location, which is open 8 o'clock to 5:30 or 6 o'clock. They can get their injections by our qualified nurse and then wait in the waiting room for 20 to 30 minutes, or they can try to stay in their car and then they can go home and monitor for any side effects.
Okay. And what you said that that the injections are safe. Are there any side effects?
They're very safe
Mhm.
in terms of they have minimal side effects. The only side effects that most commonly see is a local redness or feel warm in that area. Sometimes they develop a little raised hive in that area or swelling, which
Mhm.
usually lasts for no more a day or few hours. If, as long as it's not more than a palm of their hand, of the patient's hand, it's very fine. One of the major side effects that can happen after receiving an allergy injection or something that you're allergic to is having a severe anaphylaxis. We have perfected our therapy to a level that in last 3 years nobody had anaphylaxis, which is a good thing. At the same time, we have perfected the regimen which go together and make it effective but safe therapy. If patient has a reaction, they will have an anaphylactic reaction. And a
Mhm.
good news is our staff at all our locations, including our nursing staff, is fully capable, certified, and qualified to take care of even if the patient has anaphylaxis. There are procedures established. We have epinephrine already available. We have steroids. We have antihistamine. So when patients after the injection therapy wait in the waiting room or in the car, if they experience any side effects, they can come right back, and we have a procedure room dedicated for anaphylaxis, and
Mhm.
our qualified staff will take care of them right away. And hopefully, most of the time, 99% of the time, they do very well, and they do not even need to go to emergency room or anything, and we take care of them right here.
Oh, that sounds great. Um, as far as the injections go, how or when will the patient start to see a difference
So
in
it
the
depends, yeah.
symptoms?
So it depends on the patient's clinical condition and severity of symptoms.
Mhm.
If the patients are consistent in coming every week or twice a week, I would say in 6 months to 1 year,
Mhm.
most of the patients find at least 60 to 70% relief during the first year. In second year, they find 80% relief, and during the third and the fourth year, they almost get 80 to 90% relief in their symptoms. I'm not saying that the 100% of the symptoms will go away, which sometimes they do, but we at least promise that at least most of the symptoms will go away, and they do not have to take any of the antihistamine medicines or topical nasal sprays, which are not the most cost effective way of taking care of their overall health.
Okay. And as far as these oral antihistamines go, what are your thoughts on taking an antihistamine daily? Are there any kind of side effects or long-term effects of taking antihistamines
Yeah,
daily?
so as you can think of any medicine, there are side effects with taking the medicine on a daily basis. Even the most benign antihistamines can cause side effects. The most common side effect of antihistamine is you start feeling sleepy. Even the non-sedative one can cause to be sedated. And if you are in certain type of jobs which you cannot be sedated, like you're a heavy machine operator or something, you cannot really take that. Also, if you take the antihistamine for long enough, you build tolerance to that. They will not be very effective after like a month or 2 months because the body kind of finds way around it. One of the major side effects which we all often ignore is histamine is also a neurotransmitter, and prolonged use of antihistamine even for a few months can lead to memory issues, and those memory issues can be long term sometimes, so you will start being forgetful about what happened 6 months ago or a year ago, although they are not major because they are not majorly studied, but they do cause those effects, especially in kids. I try to avoid giving long term antihistamines.
Okay. And as far as the injections helping with allergies, does it also help with atopic dermatitis or eczema?
Right. So atopic dermatitis is one of the conditions that we see a lot in our clinic. A lot of times these are young kids, mostly less than 10 years of old. They have several allergies, including environmental allergies, food allergies, dust allergies, dog and cat allergies. Allergy injection therapy is one way of treating their atopic dermatitis, but there are other ways to treat atopic dermatitis as well. When the patient comes in with atopic dermatitis, we try to prescribe them topical treatments, and we try to prescribe less steroids or prescribe steroid sparing agents. We have created a special formula of moisturizer for most of these atopic dermatitis patients with the combination of the best ingredients available for these patients. If they use the moisturizer along with very slight dose of topical corticosteroid and some corticosteroid sparing agents, most of the time with the effective way that we have designed these therapies and perfected these formulas, their atopic dermatitis can get go away within a month or two. But then to cure their allergies for a long term, we recommend some of these patients, if they are over 5 years of age, to consider allergy treatment with allergy shots. Allergy shots are very curative, and they're very effective in controlling the symptoms of atopic dermatitis. But it just takes a little bit longer, a lot of patience from the parents and the patient themselves, but it's very effective. Sometimes, if none of these therapies are working, we can always consider a biologic therapy like Dupixent sometime. And that's very effective in our practice. And we have several patients receiving it, and there have been remarkable results using combination of our topical treatment with our moisturizer, specialized moisturizers, along with the allergy immunotherapy and Dupixent therapy.
Can you discuss what the specialized moisturizer entails?
Sure. So we, over the past 10 years or so, we saw a lot of patients struggling with finding the right therapy for their skin. They were not able to moisturize or have enough hydration in the skin, and we were struggling. We recommended everything which is available in the market. One product works for one person, the second product works for the other person, and we try to figure out, is there a way we can come up with the best ingredients available and combine them all together and come up with a specialized formula which is not available commercially in the market, and offer it to our patients for atopic dermatitis and see if it works and helps and help them cure the condition. So we combined a lot of ingredients with like vitamin A, vitamin D, colloidal oatmeal, essential ceramides, anti-inflammatory agents, and we combined them all and created a specialized high hydration formula for the patients. This can be used in the young kids or even the older adults, and very small amount, multiple times a day, can be so helpful that most of the patients are able to get off of their continuous use of corticosteroids, which was thinning their skin and causing hyperpigmentation marks. Our patients are very happy. We are now formally launching the brand by itself, and hopefully it will be soon available for a general public to buy either from our website or online.
So can patients purchase this in the office?
They can purchase it in the office, or they can purchase it through the website, or they can even go to some of the major retail stores. Or sometimes we are working right now. We are working with getting it through the Amazon as well.
Okay. What sizes are available
There
and
are
how much?
we are just coming up with one size right now. It's a 8-ounce size and a 4-ounce size, depending on what's the demand. We're gonna come up with the best solution, but that's one of the ingredients available.